There are many factors and many determinants of success. And the success rate is mainly linked to the skills of the surgeon, the abnormality at the level of the nose, and also the expectations of the patients. When it comes to the skills of the surgeons, well, it's good to have an experienced surgeon that is capable of dealing with the different challenges of rhinoplasty. When we talk about the challenge of the surgery itself and the nasal abnormality, there we mainly think about previous interventions, trauma in the past, and other conditions that may have an influence on the surgery or on the post-operative healing. But what is nowadays one of the key determinants also of the success of rhinoplasty is actually the aim of meeting the patient's expectations.
It's very difficult to tell the determinants, but because there are many. It starts with the psychological status of the patient. The second one is if the patient knows what he wants, what he or she wants. It's very important. And the third step is if they are realistic or not. After a nose surgery, they dream to look like a movie star. But we will only change the nose, not whole face. It's the very important point that we need to tell the patient before starting the surgery. We will do only a nose job, not a full face or not a full body. We will not be able to change everything.
Half of my job is a correct analysis. Only if you do a correct analysis, then you find the right tools to do that, and you have also the right arguments to discuss with the patient.
Each patient has its own facial features, some limits of his facial features because of his very individual facial anatomy. And we have to understand that, we have to talk with patient about that. Facial analysis is a key point aspect of preoperative assessment of preoperative step of nose surgery, because we do a set of photos. In our practice we do 20 views. It's pretty big amount just to analyze in different angles, in dynamic poses, all asymmetry, all special aspects of that patient. Even we can do sometimes, if we determine some kind of asymmetry, we can do even a small video just to identify the muscle movements, how they do improve, which impact do they have on the mid-third of the face where we have the nose. And after that we do also morphing on the base of this facial analysis and photos, just to discuss with patients which changes we can do for him that will suit for him.